Grad School 101 with Dr. Bradbury.
Hi, I'm Dr. Bradbury. Welcome back to Grad School 101. Today we're going to talk about a question that I get very frequently from very high-achieving students who have bumped into the idea that they know they want to go into mental health. They're very interested in problems of mental health and mental illness, but they can't decide. They're having trouble deciding, should I become a psychiatrist or a clinical psychologist? I'm trying to decide whether to go to medical school and become a psychiatrist or whether to go to graduate school and obtain a doctorate in clinical psychology and become licensed to practice that way. So I want us to talk today a little bit about the differences between psychiatry and clinical psychology. I feel very fortunate to have cross-trained with a lot of medical professionals, including a lot of physicians and people training to become psychiatrists. And so one of the advantages of that type of interdisciplinary training is that you get to learn a little bit about the different cultures of the different fields. So there are a few things really to think about, and it's a very personal decision, of course, which big choice, right? It's a big issue in your life, which place you're going to go, where you're going to go toward in this way. But remember that you will be able to figure this out. It's just a matter of making sure that you kind of think about all the different elements and how they apply to you personally. So one really great thing that I was told one time while I was training with psychiatrists, and one of my supervisors said something that I've often used as I think about the way that these different fields work, when she explained to us that in psychology, the best graduate students, the very best trainees in clinical psychology, are the ones who ask the best questions. Whereas in psychiatry, the very best trainees are the ones who give the best answers. So remember that the two fields have a little bit of a different sense, a little bit of a different cultural concentration there in terms of the way that we look at what we're engaging in. And usually in psychiatry, there's going to be a little bit more of flowchart thinking, coming up with a specific answer that is a correct answer. And in clinical psychology, much more, what we're going to be saying is, how can you approach this question? And can you frame questions in a way that's very useful? So that's one way to think about the distinction. Now, let's talk about some pragmatic distinctions, right? Like if you end up being a psychiatrist versus you end up being a clinical psychologist, what does this look like? Well, first of all, you have to decide what role research plays in your life, because certainly research can be an important part of the career of a psychiatrist, but it's very commonly a very important part of the career of a doctoral level clinical psychologist. Many clinical psychologists are actually researchers primarily and may do some type of clinical work secondarily, whereas most psychiatrists are primarily in practice, they're physicians practicing with patients, and then some of them are also involved in research-related tasks. So that's one kind of common distinction also, between the two fields. Now, the other way to think about this is sort of if in fact what you want to do is practice, right? And you're like, okay, well, the research thing is sort of not so much what I'm going toward, and instead what I want to do is practice, but I know what I want to do is practice with a doctoral level license. I've already determined that. Then think about these differences when it comes to practice. One difference is that as a psychologist, my malpractice insurance is a great deal less expensive than the malpractice insurance of my colleagues who are psychiatrists. And in general, I would say all of the costs of practice are more expensive for psychiatrists than for psychologists. We have a little bit less overhead in terms of the type of practice that we have to run. Mostly that difference in malpractice insurance rates has to do with the fact that, at least in Texas, clinical psychologists do not prescribe medications, and a lot of the litigation that comes out of the concept of malpractice is actually related to medications that have been given to people. So psychiatrists are much more vulnerable to litigation and have to deal with a much more malpractice issue very frequently than clinical psychologists do. So that's one distinction in terms of cost. Another thing that really raises costs for psychiatrists is that psychiatrists very frequently, because they're medical doctors who also do physical exams, are required to have at least one person on staff who will be there and will be present when they are seeing their patients. Whereas many clinical psychologists who are in practice, we just have a little office and we put out our shingle and It's just us. And that's something that's completely acceptable and allowable in the clinical psychology practice, but it wouldn't be in a psychiatry practice. So that's a distinction there. Now, another important distinction between these two fields is how much money you're going to make. Now, it is the case that psychiatrists make a good bit more money than clinical psychologists, generally speaking. Now, there's a lot of overlap, though, and some of those choices, it really depends. So some of those income differences really depend on the choices that particular practitioners have made, how it is that you organize your practice, what type of population you're working with, what type of job you accept, whether you're working for a hospital or not, those kinds of choices. And so there's really a lot of overlap when it comes to income, but it is the case that if you're looking for the most lucrative, the most financially rewarding mental health profession, you would go more towards psychiatry. And in clinical psychology, somewhat less so. Sometimes I like to joke about what type of car I drive versus the types of cars that my friends who are psychiatrists drive, right? Just like that. All right, other than that, the other kind of big distinction, I think, really is in the way that you conceptualize and think about people's problems. And to me, this is one of the biggest differences between psychology and psychiatry. In clinical psychology, you have a variety of theoretical orientations, and primarily, different psychologists think different ways about different mental health problems. So there isn't always consistent agreement about where a mental health problem comes from or what the most appropriate way to treat it would be. In psychiatry, it's much more common for all psychiatrists to be using a biomedical model of health, and for that biomedical model to lead them to biomedical solutions. So very frequently, of course, in today's practice, even though many psychiatrists wish that they had more time for doing therapy, it is the case that they usually don't. And so generally speaking, psychiatrists today are expert psychopharmacologists. If you're very interested in issues having to do with brain chemistry, how it is that the brain reacts to different types of agents, different types of medications, and how it is that different medications work together, both for good or for bad, then this definitely would be something that would lead you towards psychiatry. Because very often, my colleagues in psychiatry really know every little bit of things that there is to know. They know so much about the way that psychopharmacology works. So if you really love psychopharm, then that's definitely something that would lead you to be a fantastic psychiatrist. If in fact, psychopharm isn't so much the direction that you're going, and what you prefer instead is to have a talk therapy model, if what you want to do is see your patients probably once a week as opposed to once a month, and probably for an hour a week as opposed to about 15 or 20 minutes about once a month, then that practice model would lead you more toward clinical psychology and would suggest that what you want to do is have an outpatient therapy practice as a clinical psychologist. All right, so I've inundated you with a little bit of information today about the differences between psychiatry and psychology. Bear in mind that clinical psychology and psychiatry are both fantastic ways to contribute to society and fantastic ways to contribute to the mental health of others. So either way you choose, it's going to be a fantastic choice. Thank you. This has been another edition of Grad School 101.